What's up everyone, Dr. Dan over here at the gym with the table here. This is a great video for a lower body workout and to help you guys obtain and achieve a little bit more spine neutral, all right? So a lot of these exercises you're learning here in the office, but I want you to press play at home and practice these exercises for anywhere from 5 to 10 minutes a few times throughout the day to help improve your posture and help us to obtain a little bit more back chain dominance, right? So we get out of the kind of like the front slump or maybe the tight hip flexors, depending on what we're working on with you. This is a decently high table, countertops at home or maybe a little bit higher, but if you're a patient in the office, we've talked about learning how to hip hinge, and this video is gonna show you how to do that, right? So if you have your phone, your computer at home, if you guys are doing any kind of work in the kitchen, just hanging out over the countertop, brushing your teeth in your bathroom, you want to learn how to hip hinge. And I'm going to go through about 4 or 5 different exercises to show you how to do that, right? So on countertop at home, we're going to plant our feet shoulder width apart to start off with, and we're going to put both of your feet completely forward. So first and second toe is going to be straight forward. We're going to wide fingers, and we're going to put the hands down on the table. And what we're going to practice is going to be a series of things. 1, chin is going to be pulled back. 2, lats are going to be pressed on, so we don't want to be tight up in the neck. We want to work on depressing and pulling the shoulder blades down. And the bottom portion is the low back extension, where we work on reducing the amount of round that we have in the lumbar spine and the thoracic spine, and working to tilt the pelvis backward, right? So if we tie all 3 exercises together, we're working on a chin tuck, a lat press, and then a slight low back extension. And then down in the bottom, you're gonna work on just straightening those knees out, getting that nice stretch down through the back side, okay? So this exercise is important for anybody who finds themselves sitting or slouching forward and causing that neck tension, that low back tension, and ultimately hip knee problems, right? Fingers, chin, lats, low back hip extension, straighten the knees. That's video 1 that we're working on right here. Chin tuck, lats on, low back extension, straighten the knees, and hold. If you have your phone at home or your computer, you can work on computer work at home in this position. You can work on answering emails, reading your news, whatever it is that you do at home. You want to start to work on this low back movement to get us out of the rounded position, okay? That's exercise 1. 2 is going to be adding in a slight lateral shift. Lateral shift, we're going to set up the same position, and we're going to laterally shift to the left, straightening the left leg, and then over to the right, straightening the right leg, and then the left, straightening the left leg, and the right, straightening the right leg, holding for about 5 to 30 seconds. Really, if you want to just hang out, if your right side is tight, and you want to hang out here for a minute, 2 minutes, and just work on that pelvic extension with low back and lat activation, really good, okay? So, at home, answer your emails, text your friends, whatever it is you're doing, get into your hip hinge position. 2, add in the shift, left and right, okay? 3rd exercise, all we're gonna work on is pulling the foot up for 5 to 30 seconds, and then pulling the other foot up for 5 to 30 seconds. Left foot up, right foot up. Left foot up, right foot up. Time scheme, about 5 to 30 seconds. Okay? We can add in a shift and pull the foot, add in a shift and pull the foot. Okay? So these are all progressions of the same exercise, which is that low back extension. All right? Now the 4th one that we're going to go through is a little bit more upper body dependent, still low back, but it's really working your spiraling muscles or the coiling muscles that we talk about. And so what we're going to do, we can't text or work in this position when we do this exercise, but what we're going to do, we're just going to raise our arm out to the side and work on keeping that low back in that extended position. We're going to hold 5 to 30 seconds. Arm down, lat down, back extended, right arm up, back extended, 5 to 30 seconds. Left arm up, 5 to 30 seconds. Right arm up. If you feel like you're getting a little twisted or one side is easier than the other side, let's default back to just the back extension, straightening the knees out, setting the chin back, and getting us in this nice, strong spinal posture, all right? And break, okay? Those are your low back exercises. We went through 4 of them. The general hip hinge, the shift left and right, the toes up, and then the upper body rotation. You want to practice these exercises more than once per day, 3, 4, 5 times per day. If you brush your teeth 2 times or even 3 times per day, every time you bend to spit in the sink, if you're brushing your teeth, we don't bend this way. We start to bend mindfully. Hip hinge, we're working on our computer, hip hinge, texting our friends, hip hinge, reading something, get into your hip hinge position, okay? So this is your strong low back leg stretch protocol. You want to try to do it 3+ times per day minimum, and we can talk about some progressions in future videos, all right? Ask questions, email us at info@turackchiro.com if you have any questions, or reach out to us on Instagram or YouTube. We'll see you guys on future videos.